Done? Yeah? Brilliant. Yeah, good morning to you all and welcome to this Zoom meeting. In attendance with me are my colleagues Ramu, Jan, and Judita. So first of all, before we are going to start, I would like to ask everyone to introduce himself or herself. I'm going to start from myself. My name is Mr. Usman Gay. I'm the community development worker for Family Voice. Yes, the next person is going to be Reba.
Hello, I'm Reba Hussain. I'm an engagement officer for Health Watch Cambridgeshire and Peterborough.
Thank you. Judita, please.
Oh, my name is Judita Grubliani. I'm parent representative at Family Voice Peterborough.
Javid, please.
Good morning, Javed Khan, Peterborough City Council. Thank you.
Yes. Amy, please.
My name is Femi Olashoko, and I'm the Near Neighbors Coordinator for Peterborough. We work with community and faith groups to help them look for funding and to support the activities that they do in the community.
Grace, please.
Hi there, I'm Grace Spencer. I'm a researcher from Anglia Ruskin University, and my work really looks at young migrants that have got long-term health conditions, and I'll talk more about that in due course.
Tina, please. Tina, please. Tanya, sorry.
Hi, I'm Tanya. I'm parent carer to children with special educational needs.
Thank you. Chris Ho.
Kishore.
Kishore, yes, sorry, man.
Yeah. My name is Kishore Ladwa. I'm the current president of the Hindu community in Peterborough.
Thank you. Jan, please.
Sorry, I've introduced myself a little bit, but I'm Jan. I'm the forum coordinator at Family Voice Peterborough.
Thank you. I think we got Agnieszka.
Hello, I'm sorry, my camera a bit playing all the time. I'm the parent carer, live in Peterborough.
Amy, please.
Hi, I'm Amy, and I'm going to be interpreting today.
All right, thank you very much. All right, I think Ramu can't hear me. Ramu is the administrator for Family Voice Peterborough. So hopefully she is busy at the moment. So now we are going to kick off with the meeting at the moment. So our main purpose of this meeting is to talk about the post-Brexit and the impact of COVID-19 to our communities. We would like to hear from you about how you think Brexit is going to affect you in any way. And we are more than happy to listen to you or to listen to your concern, and will therefore be happy to help you in any way we can. We all know it has been really difficult few months, and it is still ongoing, and communities have been affected differently. So that is why we have called on this meeting to hear from you, the head of various communities, and how the pandemic have affected your community. This will help us at Family Voice to be able to reach out to your communities and offer them the right help they need. So now, before I'm going to give you guys the floor, I would like to invite Javid to come forward to have the floor with him, please.
Well, thank you, Usman, and thank you, Judita and Jen, to allow me that. I'll be very brief I would like to cover, in particular, 3 points, but I'll be very more important to listen. I work with Peterborough City Council. My role is to working with different community groups like who are present, but also partner agencies like Public Health, Clinical Commissioning Group, and others. I'd like to talk about COVID-19 situation, currently where we stand. Since lockdown, our situation in Peterborough has been, I've used one word, is stubbornly high. So I'm sorry, this is not the best news anybody wanted to hear, but that's the fact. So Cambridge and other places, for example, all went very high before the lockdown. And then what has happened, for example, compared to Cambridge, the figures have dropped down very quickly over the lockdown period. In Peterborough, the figures remain roughly around the same height. What I mean by that, we're roughly in the region of about 500 people per 100,000. Now, that, to be exact, a few days ago, we were like 487, which is a marginal drop. But if I compare with east of England, it's 458 per 100,000. And compared to England, it is 437 for the 100,000. These are differences. But then if you look at compare like Cambridge, Cambridge is 300 people per 100,000. I'll come back to this point in a minute. Our positive response, positivity rate is also relatively high. So number of people who go to test, 14% of them come back with positive, which is relatively higher than others. And we have a problem in terms of infection. In terms of the elderly or 60 and plus, they account for, don't hold me exactly on that, I don't have exact figures, but a significant portion of the people hospitalized are obviously in that age group, but that probably is what you can hear even from the news. So we need to work high, and mortality, number of people that are dying, is still something, a challenge for us that we need to bring down. I don't have exact figures now in front of me at this moment. So the short, to sum up, for COVID-19, our situation in Peterborough remains stubbornly high, and we need all the cooperation from all the community groups to follow the advice about social distancing. One advice I'd like to particularly highlight, because everybody knows about the hand space and face, so I won't repeat that. But one thing is household transmissions. And there's going to be a flyer coming out available today or tomorrow. It basically says that people think that somebody from outside is going to bring that virus to me, or if I don't go out, that virus will not come to me. That virus can be brought in by our loved ones. Somebody, if who is coming back to home, and if he or she is mixing with a large group of people, and I have not gone anywhere, the virus can still come to me. So it's very, very important that everybody in the families are abiding by the social distance. And I know sometimes in some professions, it's going to be very difficult. Example, if you work in a hospital, if you work in a school, you will meet with people, but then you need to take extra precautions. Otherwise, that spread can take place. So this infection is not brought by a stranger, or could be brought by a stranger, but could also be probably by some loved ones. My second point is vaccination. The vaccination has been rolled out, and as you are getting information, there are more and more places coming up for vaccination. But we are also finding that we need to address the myths or misconceptions about the vaccination. So I'm really interested to hear from yourself as to what is that you may have picked up, even if it is one or two individuals, doesn't matter, because your feedback to us means that we can try to address those myths. Lastly, there is something which I want to talk about. It's called, in short, it's called LTS. LTS, it explains for is rapid testing. Rapid testing. So some people, I know 1/3 of the people may not have symptoms, but they might be carrying the COVID. And then accidentally they spread to other people. So what we are doing with public health is that we are finding groups like Family Voice, where they could have some opportunity that people might maybe drop in their children, maybe come in for some advice. If we give some of this kit to yourself and give you basic training, would it be possible to get that test and give it to us? So then we can be able to check out of 100 people, who had no symptoms, this percentage came up. And this is the circumstances. We're doing similar tests with other groups like homeless people, any other groups where we know their people are coming. We'll try to do this. So I would like to appeal to any group, if you're interested. Maybe we can contact, you can put in your chat, or you can contact me. I put my email, and I'm very happy to work closely with anybody. I know this is a heavy topic today, and I don't want to take too much time, Osman, but I'm really happy for any feedback that anybody, or any query, any question, and I'll try to answer or try to find the answers. Thank you very much.
Wonderful speech, Javed. We are very, very happy to glad. If we can have someone to be trained in family voice for regarding about the COVID testing. So that's what we
want to ask, Javed, if you could email me, it's jan@familyvoice.org, and I'll get somebody either.
Yeah, I'm quite happy not to put anybody on the spot, because obviously you need information. So if any group, I mean, there are many.
I've lost you.
We lost you. We lost you.
Groups present here, most of the people on the. So if they're interested, just put something on the chat box or write to me later on, and then I'll contact you. And but I'll ask the Family Voice anyway to make sure that you have got the information. Thank you.
Lovely. That would be useful. I mean, I'm sure somebody would be interested. I mean, I might do it myself, or it could be one of our parent reps. Thank you.
Yeah. Thank you. Thank you very much, Javi. Can I give Dr. Grace, please, to come forward? You know, I think she has something very, very important for in our meeting here, and I think everybody will be benefited from that anyway. So, yeah.
Thanks very much, Usman, and thanks very much for the invitation to join you all this morning. It's great to meet everybody. I'm here really to talk a little bit about a project that I'm leading on the experiences and perspectives of young people that have migrated to the UK that have long-term health conditions. The project really is just to try and find out some of the key issues and challenges for young people and families that are living in the UK, and also trying to manage a long-term health condition at the same time. So unfortunately, the project, like everything in life, has been disrupted by COVID, and we were planning a participatory workshop with families, community groups, nurses and young people to explore some of the issues, but we're now hosting that online. And we have a workshop this coming Friday. So I can post the link to the registration for the project in the chat in just a moment, but we would like to extend the invitation to all of you, but also your networks and contacts. We're particularly keen to hear from young people and families about the real issues that they encounter, so that we're learning very much from families themselves. Of course, the workshop is just a matter of days away, so I appreciate people might not be able to attend, but we are also keen to talk to people on a one-to-one basis by way of an interview. So if you think you might be interested, or you think you might know of a young person that might be interested in talking to us, please do contact me, and we can arrange a time to have a chat with them in an informal way. And really, as I say, the important thing about this project is to really hear from communities and families themselves to know what the key issues are, and then to help inform and better support young people with the management of their long-term conditions, and also develop training for nurses and other healthcare professionals that support migrant groups about some of the key issues that are important to them. So I'm happy to take any questions, but I'll post the link in the chat function, and if anyone wants to know more about the project, then please do let me know. But I hope that as many of you or contacts might be able to join us for the workshop on Friday.
Hi, it's Jan here from Family Voice. I don't think I've got my video on at the moment. Hold on. I think we might have already advertised something about this project last week, I think it was. So hopefully people have seen that on our web pages. So I hope, obviously it had your contact details on it. So, hopefully people will be contact you to join that. But yeah, we have posted it on our various social media. And it's a really interesting project. Can you, I need to look at it myself actually to see whether I can attend. I don't think I can, because I think it clashes with something I'm already doing, but it sounds incredibly interesting and useful. Thank you.
Thank you, Jan. Thank you.
No, thank you very much, Grace. Yeah, I think, yeah, like John said, if you could share it with us, that will be absolutely fantastic anyway. So, yeah, do you have anything to add, or you just, yeah? Uh, 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 Grace, do you have any more to add, or you just, finish now?
No, as I said, I appreciate many people might not be able to attend on Friday, but if you are interested in more of a project, then do send me an email. And
Yeah.
if people are happy to, I might send a follow-up email as well, just to see, I appreciate it's a difficult time for everyone. So, but in the coming weeks, if people are interested and want to share some of their ideas but can't come to the workshop, then I may approach people if they're happy for me to do that.
I think you got our contact. It is possible to, give us the time on Friday, so that if there is any possibility that we can, attend it, definitely we will definitely do so. Yeah, myself or Judith or Jan or anybody. So anyone.
Okay. The workshop's 10 till 12:30 on Friday. So and I've posted the link in the chat.
Please, please. Thank you very much for that.
Thank you very much
for having me on board. Yeah. All right. Yeah, I think I will allow Judith to come forward anyway to to explain about the post-Brexit as well, which is really, really important anyway at the moment. So yeah, Judith, the floor is yours now, please.
Right, thank you, Osman. Thank you very much to each one who already made a speech and shared very important information with Family Voice Peterborough. Thank you, Javed. Thank you, Grace. And we will hope to keep contacting each other and keep in touch with each one regarding all these issues, this difficult time comes to us. And I would like to speak and to ask you to make a discussion about the issues you facing probably within communities, especially within communities with send families and kids accessing NHS, accessing different services, or maybe struggling with some help. And we would like, as an organization, Family Voice Peterborough, which makes signposting and all other kind of help to families with SEND. Also, I would like you to ask to make some discussions of the parent carers issues. We have now very difficult situation with pandemic, but also we have the different situation regarding the Brexit. Yeah, what was happened in this country. So a lot of migrants, families, and people, they probably has some impact for their everyday lives regarding all this. So let's talk about that. If you're struggling with some help accessing, for example, some services, NHS, or if you have some issues with some other things or stuff, please contact Family Voice Peterborough. Please ask us for help. Please, no need to suffer alone. So probably I would like to start with my own experience, what happened now in our family and what issues our family has now. So we have a lot of problems now with NHS. We have a lot of problems now accessing doctors, and our arranged appointments with doctors are postponed from October, and they were postponed to November, then they were postponed to December, then to January. Now in January happened nothing. We couldn't even reach doctors by the calls, phone calls. So now we are trying to write letters. So also we are struggling to get the treatment. Whole year passed in our family since the various very important sickness happened with our loved one, and we still not getting any treatment. Even the treatment was ordered in the middle of November, but there is nothing, and we can't get it. We're just getting some advices, we're just getting some pain reliefs, but not real treatment, or what has to be delivered to us. So yeah, it's very difficult to fight these fights alone. And if you have some experience sharing with us, so it would be very lovely to hear from you. Can I ask somebody to start discussion and to share their experience?
Thank you very much. Thank you very much, Judita. Yeah, we would like to, give the floor to the audience. If any one of you have something to say, you are highly welcome, please. Yeah, because we definitely, like I said earlier, we want to hear from you. We want to know your concerns. We want to know the problems. Then if we can help, definitely we will do our best anyway to do so. So if any one of you want to come forward, Femi, Taina, anyone, anyone want to come forward, please, you are more than welcome. Or Rebois, any one of you, please. Anyone, please. Yeah.
I'm supporting some families that have got current mental health issues, and I've been contacting the mental health team on their behalf. And I've had the same issues. They haven't been able to seek counselling, to seek any support. They've been on waiting lists for prolonged times and just not getting anywhere. And I find this very frustrating because obviously they can't get the help they need. And I think there needs to be other ways looked at to be moving forward, because if this COVID's going to carry on for a long length of time, they need to be able to support vulnerable families other ways, maybe by Zoom, maybe by different ways of communicating with families that need support and need help.
Yeah, thank you very much, Taina. Jan, would you like to respond to that, please? Yeah.
I think I can only respond really personally, I guess. I've been off sick myself. I was off work, although I've been sick since before Christmas. So I've got COVID. I've had COVID. I'm waiting for the results of my latest test to make sure I'm free of it. But it has left me with various, fatigues, all kinds of things. Anyway, so I've had experience of trying to contact doctors, etc. I've got to say my personal experience has been very, very positive. My surgery has set up a really good system of contacting people. They've got practice nurses, various nurses in there to give advice over the phone. They liaise. I've got to say the liaison between 111, the emergency number, and the emergency care centre, which I think is up in the other side of town, has been brilliant. So I had calls. I had to have an ambulance out to me when I was at the height of my COVID. The ambulance came and responded within 30 minutes. So I was very lucky. I know that's not always the case, and there are people. The paramedics were with me for ages, and they were going to talk about admitting me to hospital, but I managed to stay out of hospital. But they were fantastic. They were with me for ages. But also, they said that they are having to prioritise. So because there are so many people, more people calling them out, there are people having heart attacks and they can't respond to them. So people are actually lying on the floor, having a heart attack, and there's not enough ambulances to get out there to them, and that's the reality. So although my experiences with my own GP surgery and the chemists next door, they were fantastic. I have heard lots of problems with trying to actually get hold of any medical intervention, like Judith said, and like Tanya said. In some cases, there's one particular surgery that's very local to me, and people just can't even get an answer on the phone. It's just constantly ringing out, constantly ringing. And these are people like Judith has mentioned, that have a need for medication or ongoing care, and they're just not being able to access it. I've also heard of parents who've got children who have complex health needs, physical disabilities, etc., who are reliant on certain medicines, running out of medicines and not being able to get them. I've also heard of one child in particular, this is the example, and I know that Tanya was saying that she's supporting families with mental health issues and just simply can't get hold of the services. We had one very concerning situation where a child had been put on medication for ADHD, so he's on risperidone or something like that, and had been for quite a while. Because of the lockdown, they cancelled his face-to-face meeting, his review. In the meantime, they told him to stop taking the risperidone, wouldn't give them any more, kept cancelling responses. In the end, they managed to offer his mum an online review, which she missed. Unfortunately, didn't go to the right email address, so they took the whole family the child off the canned list. They actually removed, because he'd failed to attend a meeting online that they didn't know about, they took him off of their list, and so they've got to start all over again. And this child's been taken off his medication.
All right. Thank you very much, Jan. Before I give the floor to Reb Femi and the rest, please, Javid, would you like to add more about the post-Brexit, please? Yeah.
Sorry, Osman, Grace has got her hand up.
Yeah, okay, that's fine. Grace, do you have anything to say before?
Yes, sorry, just to respond to Tanya and Judita's and Jan's comments. Obviously, in my capacity, I can't directly support or help these types of issues, but I think it's incredibly important that these types of challenges are documented, and this is part of the project that we're doing. So again, just to reiterate that, you know, these kind of examples that families are encountering and the challenges are really incredibly important to, as I say, to document properly so that we can look at new ways to move forward with some of the issues. And again, I'd love to hear from you all, and Tanya, you talked about other ways of moving forward, what suggestions there might be, and actually getting this pushed forward so that that action can be taken as well. So again, that's part of our rationale for doing the workshop and the interviews. So again, just to reiterate, it's important to document some of those things for us.
Fantastic.
Grace, that's really useful, because sorry, Osman, I just want to say that's really useful, because sometimes you don't really need to know where to go with this information, and sometimes people go, oh well, it's just the way it is at the moment. You cannot just take a child off of medication and then go, oh, I'm sorry, you didn't attend an online interview or an online meeting, you're now taken off the list. You know, I think there's an over-reliance on computers and on the internet and online stuff. People are, not everybody is that conversant with being online. This parent wasn't, and she had a very poor internet connection. You know, she unfortunately missed the email. So there is an over-reliance on computers and IT, etc. And some people just don't have it, you know. And we're looking at ways and how we can support that ongoing. You know, whether we can provide some training or some funds. Is there any funding out there for families to become more conversant with IT? Can we get hold of IT for people? Is there any funds that will help with things like broadband payments, etc.? But there is, we've got parents missing out, and very, very sick children at home, and parents absolutely beside themselves because they're just watching their children get sicker.
Absolutely, yeah. And as I said, I think it's really important that those experiences are fed into, places that it needs to go to, whether that be training for healthcare professionals or staff working in health and social care settings, but to really capture what the issues are, to better support families dealing with these issues. So again, nothing I can do can directly help individual families or young people, but I think it is really important to have a mechanism to feed that back up to places and spaces that could take action and develop training and support for families. So again,
I got only 15. We got only 15 minutes to go now. Javid, can I kindly hear from you? Then I will give the floor to Femi and Rebwa and Kishore for them, to comfort and discuss whatever they want to say, please. Yeah, thank you.
Thank you, Usman. Anybody who has got issues relating to IT and access or use by children, Obviously, they should approach their respective schools. But if there's a problem with that, they can always come to the Peterborough hub 747474, and we can carry on with the individual case. That's the best way to deal with any problem, and then we will find other problems. Any individual case, come to 747474, and we'll see what we can do.
And can I just say how brilliant that hub is? That I've used that hub myself because of my experience with COVID. I was in need of a couple of bits of advice. Somebody said, go to the PDDCS hub. I already knew about them, obviously, because I liaised with them through my work. And I've got to say, I've always found them absolutely amazing. What an amazing initiative. And the advisors are really responsive and knowledgeable.
Yeah, thank you very much, Jen. That hub is actually overseen by Deputy Chief Executive Wendy Ogle-Wellborn. So they try to find solutions outside the box. Sometimes it's not necessarily a simple, straightforward. But if you do still have problems, come through Osman or yourself, write to us, and we will always go back and challenge if there's necessary. So that's just one way that any individual should not lose out if we can sort it out. Brexit, I just got 2 points. One is currently EU settlement scheme is important for people to complete if they haven't done it. The one advice we want reminding people is that some people may have registered for EU settlement scheme themselves, but their children born in this country also required to be registered. If they don't, the children do not have that status. So in a way, it's very important to remind for those who are required to settle for EU settlement scheme, if you have got children, even if they're born in this country, please register them separately. If you need any help, you can go to Parker or you can go to Gladka. And again, I'm sure Family Voice have got the information for both of these organizations. These organizations have got resources and commitment or expertise to advise and link. One of the problems which has been raised to our attention early on is new arrivals and getting NIs, or difficulty to get NIs particularly with the COVID period. So if this is a known problem, we have reflected this to the national levels. But if there's again any individual family or individual person encountering problems with benefits, food, or whatever, just because he or she is not able to get an NI, again, the magic number is 747474, and we'll try to see whatever we can do. And I'm aware of individual cases where we have been able to find solutions or try to do our best. Thank you very much, Usman. I need to go away, but if there's any comment, please send it to Usman, and I'm very happy to follow up individually. And I've given my contact as well. I've got an event starting at 12 with the Holocaust Memorial Day, and I welcome anybody who has got time to link in to join in as well. Thank you very much, Osman and Jen and Judita.
Thank you.
Thank you very, very much, Javed, for the useful information. I hope everybody will contact. Anyway, I will try my best. Anything we have from Family Voice, definitely we will contact you and seek more help from you. Yeah.
My apology. I'll need to go now. Thank you very much.
No problem. Thank you very much for your time. Thank you very, very, very much. Yeah. I hope to see you next time. Yeah. All right. Femi, if you would like to add anything, please. Yeah. Can you kindly come forward, please? Thank you.
I'm going to have to apologize because I'm attending the Holocaust Memorial service at 12. However, I want to reiterate what Javed said about the new arrivals. It is very important that there is a bit of community response to those new arrivals, especially in Peterborough, because I know a lot of families have had to quickly bring their loved ones into the country before the deadline in January. However, all of those people need to be integrated into the community. So it's just about us looking for projects that may want to support such new arrivals. And we've got a bit of funding at Near Neighbours that people can apply to. So if you know of a group of people that need a little bit of support to integrate into Peterborough, please do contact me and I'll be able to support to apply for that. Judita.
We will surely do that. Thank you very much. Yeah, thank you very much.
Thank you, Femi.
Yeah,
Yeah.
thank you. Now I'd have to excuse
Thank-
myself. Yeah.
No problem, family. Thank you very much for having you on board. Definitely, we really appreciate you. Yeah, thank you very much for your time. Thank you. We will definitely get in touch with you if there is anything. Yeah, thank you. Yeah, Rebwa, please, if you could come forward. Thank you.
Thank you. I just would like to let you know, actually, as a health switch, we're also very interested to collecting people's experience with the health and social care services. And if we have an information team, they provide information about if you have any difficulty to find the service you are looking for, you can contact our information team. And please share your experience, either is a good experience or the bad experience with the health and social care services. With health. It doesn't matter how small your experience actually, or it's good or bad. We are very interested to hear from you. And doesn't matter even if it is a small experience, like if you try to book appointment with the GP, you could not make it, you still can contact our health switch, or you can go online, fill the section which say have your say. This is very important to share your experiences with health switch. Whenever you have any difficulty to access to any health or care, social care services in Peterborough and Cambridgeshire. Good, thank you.
Good. Have you got any contact to share with on the chat area?
Sure. I will put it in the chat
please,
box.
so
Yeah.
that, people will be able to contact you if there is anything, please. Thank you. Thank you.
Thank you.
Yeah, thank you very much.
Sure.
All right.
Sure, please.
Okay, I'm going to talk about the success story of how we have dealt with COVID.
Good.
We are a large community. I've got members of nearly 4,000 people. We cover the whole of the East Anglia.
All right.
Okay. Since the lockdown, 22nd of February, we took it seriously. Our center, the community center, has got income of £50,000, which is a donation, but it's purely donations by the members, and we lost all that. We closed the center, okay. Then we formed a voluntary group, okay, to split into 5 different categories. We got a team of doctors to give advice to our members. We have team of chemists who, if there's a problem, we can get them. We got volunteers who are going to visit our vulnerable people. Okay, we got we got Zoom activities twice a week, and Facebook Live. All our religious and community activities, we do it on Zoom, and that's how people donate us money, and that's how we have managed to survive the COVID. Okay, and we have taken it seriously. And like Javid said, his concern was Peterborough has a higher COVID rates, infection rate, and I would ask the community leaders, okay, to take active part, to explain. We have made videos in 3 languages, in Hindi, English, and the Gujarati, okay, explaining our members, okay, what COVID is about, what to do. We completely sanitize our center. We got sanitizers installed. We did some renovation work, but at the moment it's closed to the public. Okay, all the members, if they want to worship or come to the community, we banned them all and suspended them. So everything is done on Zoom, and this activity is going on regularly. That's how we managed to come out quite successfully, and our members are okay. That's my story.
Oh, thank you very much. This is a really wonderful story, definitely. Have you got any
and on top
contact?
and on top of that, we supply hot food to the NHS. We do the donation to the food banks, and I have recently had a request to do a second hot meal for the hospital, because the ICU team, their morale is a bit low, and they were requested again to supply them food to about 30 to 40 doctors. And we'll arrange that. If we can't do it from the center, we'll do it from the home.
Sure.
because we take all the COVID restriction into account as well. And that's how we are also helping the community as well.
Do you help the individual families, those who are in need? No, or you just deal with the organization, or just
no. We do individual family on regular, but not only the Hindu communities, because we are connected to the hubs. You see, so I often get a phone call from Peterborough City Council that this lady is 60 and she has no food for today. So we got a link with one of our shopkeepers. Okay, we just ring them and they're going to donate. They go and supply the food, and then we pay the shopkeeper. That's just a donation from us.
Right.
Okay.
The reason why I'm asking that, because like as an organization, Family Voice, we also very active in terms of helping the communities in terms of food in this how to call it, difficult time. So we always try our best to help a lot of families. You understand? Anybody that who say that they are in need and they need help, we try to reach out everyone anyways, to get something for them anyway. So that's why we always call on this meeting to to ask you guys if there are any families that within your communities is struggling for food or anything, they can just let us know that if we can do anything for them, definitely we will definitely do our best to help them.
And to add on to that, we were also a new arrival a few years back, but we integrated into society because most of our members are highly educated doctors and chemists, and so that helps a lot. You see, yeah.
Hey, sure. Can I ask a favor? Could you put your contact details in the chat?
Yes.
What do you want, my phone number?
Do you have a phone number or your website or do you have anywhere where you advertise this information?
Yeah, we got a website which is I'll put the website on there.
Fantastic, thank you.
We got a Facebook page.
Fabulous.
Regular activity.
Lovely. If you could just give the title of that as well, because it all sounds absolutely amazing what you're doing. And I'd love to have a look at it, and I'll share that with my colleagues. Thank you. We've lost Usman. Lovely, thank you so much. Is there anything else you wanted to add, or anything else anybody else wants to add or comment on? We've got a very bouncy child in Osman's box. Usman's box. Where's he gone? Is there anything else?
Jan, we can't hear you.
I'm so sorry.
No,
I don't know
it's okay.
Sorry,
No,
I
it's
don't
okay.
know how I did that. I obviously hovered over the mute button. Is there anything anybody else wants to add? Because I'm aware that we are coming up to close and we've lost Usman.
River, please.
With regarding actually about the problems for finding NHS dentists in Peterborough and Cambridgeshire, we are aware of this problem, and last year, following our interview visit to both Dental Access Centre in Peterborough and also in Wisbech, the clinical commissioning group added some budget for them to treat the patient, because we know it's very difficult to find the NHS dentists in Peterborough and in Finland. But however, actually, if you ever have any problem with that, please report to HealthWatch and also talk to our information team. They will be able to tell you if there's any dentists available in Peterborough or in outskirts of Peterborough. Please contact our information team.
Good.
Thank you.
Thank you very much, River, because also I had that experience, very bad experience to find a dentist. Finally, I got that, but it was very, very difficult and took a long time, Thank you.
Thank you. Actually, but just to let you know, actually, even if you are not registered with the dentist, when you have some problem, you can go to a dental access center in Peterborough for the treatment. This is also because the clinical commission group have added some budget for them to treat patients who are not registered in Peterborough.
Yes, thank you very much for
Thank
this.
you.
Okay. Oh, anyone want to add anything? Yeah?
I think people are getting their deliveries of food. I can see Usman, you disappeared, and one of your children suddenly appeared dancing in her dressing gown. Bless her.
How do you see it?
You've got food. I think people, those of you that have wanted the pizza, I think it's pizza, isn't it, for everybody?
Yeah.
That's gradually arriving.
Yeah. Thank
So,
you very much. Yeah.
and that's as a kind of thank you for taking part. But also, the idea behind that was that actually, usually when we have meetings in a building, you make somebody tea and coffee, don't you? And if you're really lucky, we'll make you a bacon sandwich. Sorry, not everybody eats bacon, but we'll make you a cheese sandwich or whatever, or one of Asta's amazing cakes. And of course, we can't do that online. So it was actually me that came up with this idea because we had some funding, saying, could we provide our attendees with some kind of refreshment? Because there are not, I know we've copped out and we've used Domino's, which is a massive chain, but the idea behind it originally was to try and use somebody locally who had diversified into providing those little boxes of cream teas and whatever, so that we were not only making the experience of these meetings more interesting and that for our own team, but also to also help out people that had diversified and set up these little jobs for themselves of delivering food, because people they're on furlough, they've lost their jobs, they've had to go part-time and all of that, and I'm amazed by their creativity of people. So you can get anything on that. You get a roast dinner in a box now. People are doing stuff like that. So that's what the idea of this is. And now my tummy's rumbling. So is there anything else that anybody wants to add?
Jan, can you do me a favor? I will leave you guys because I have to attend the Holocaust Memorial Day, please. Yeah, can I let you guys continue, please? Because it's starting now, almost 12
Yes,
o'clock.
of course.
Yeah.
Thank
I'll
you.
leave you guys, please. Yeah, you and Judith, you carry on, please, and the rest, please. Thank you very much.
Thank you, Osman.
Thank you. Bye-bye, Osman. See you soon.
Bye. Bye.
Bye-bye. Yeah, is there anything anybody else wants to add? Please don't ask me lots of questions about Brexit, because I am really not that clever around it. But I can't give advice, but I can certainly find out information. I'm totally silent.
Yeah, Jan, I think now it is 3 minutes. Yeah, we are late to finish our meeting.
Yeah, but I hadn't noticed that.
Yeah, but I would like to say huge thank you to everybody, to each one participant, and to all the information we shared here. And I think we will meet each other in next one meeting in February. Yeah. Thank you very much.
Yeah, and thank you, Judita and Usman, for setting these up in my absence when I was away. This is brilliant. This is the best one by far. They get better and better, and the networking gets better and better every time we host them. And thank you, Amy. They're in the background signing like mad. Thank you so much.
Yeah, it's because
it's in the chat. Yeah, send it to me, and I'll make sure everybody's got it.
Okay, thank you.
Thank you. It's been amazing. There's so much going on, so many interesting things. I'm going to leave you all alone now, but we will see you again in February, hopefully. And for those of you that have ordered the pizza, enjoy.
Thank you.
Thank you. Bye-bye.